Welcome to the Dr. Gundry podcast. Well, a virus has been making international headlines over the past few months, and rightfully so. I'm talking about the coronavirus outbreak. Now, those who have fallen ill with the coronavirus suffer coughs, fever, and difficulty breathing. But interestingly enough, in most cases, the infection is so mild that most people don't even think they have an infection, and that's actually the good news and the bad news about this virus. Now, in severe cases, there has been organ failure and, of course, even death. At the time of this recording, the World Health Organization has reported more than 80,000 confirmed cases and nearly 3,000 casualties. On this episode of the Dr. Gundry podcast, I'll dive deep into the science behind this rapidly spreading illness and share tips for protecting yourself and your loved ones. This is an important and timely issue, so stay tuned and be sure to share this episode with family and friends. You could be saving someone's life. So what is the coronavirus? Well, number one, this is not a bacteria like the plague bacteria. This is a virus, and it's exactly like other viruses that you're well aware of. For instance, influenza, the flu, is also caused by a virus. This particular virus is a cousin of other previous coronaviruses. And the coronavirus is described because if you look at it under an electron microscope, it looks like a crown or the corona when there's an eclipse around the sun. So that's how it gets its name. Now, it's a cousin, as I mentioned, of both SARS and MERS. And these are coronaviruses as well. And they have made spreads and spread across the world at various times. I actually have a colleague in Palm Springs, a physician, who got the SARS virus and got it so bad that she actually developed end organ pancreatic failure, and she became a type 1 diabetic from contracting the SARS virus. So these viruses are not to be taken lightly, but this is the, if you will, latest in a strain of viruses that are called the coronavirus. And just like SARS and just like MERS, they're fairly novel to humans, even though they have existed actually without a problem in animals. And animals can carry these viruses. Often these viruses are reservoired in animals, and they make a leap from animals to humans where they normally don't exist, usually from human to animal deep contact, if you will. This virus does appear to have come from bats. Bats do harbor this virus, and bats were sold for human consumption. And the latest theory from the CDC is that a woman killed a bat, dropped some blood on her finger, later licked her finger without washing, and that's where the original transmission came from. We'll look into some of the other interesting theories out there, but this is a virus. It's a virus like any other virus, like influenza A, influenza B, but it's just a different method of infection. So are the symptoms different from MERS or SARS? Actually, no, they're not. Most of these viruses cause a respiratory illness, just like the flu viruses cause a respiratory illness. This virus does appear to be mild in its usual presentation, and that is why people have contracted this virus without even knowing they have it, because they really don't attribute this to a devastating disease. They may feel like they have a cold, they may feel a little achy, they may have a cough or runny nose. Now, in extreme cases, most of the people who are being affected already have other underlying diseases, like chronic lung disease. And we're going to get into the tips on how you can protect yourself in just a minute. So, how is the coronavirus spread? Well, it does appear to be an airborne pathogen, and it is spread with just coughing, or if you have contact with somebody else, such as shaking hands and they have the infection, they can pass it because the virus is on their hands. Can it dry? It appears the virus can remain intact for anywhere from 2 to 10 days on a surface. So someone could have, touched a surface and it still could have potentially a coronavirus if they were carrying it. And again, one of the mischief makers with this virus is a great number of people will never be ill enough to realize they have it. And so that's both the good news and the very bad news, because in previous virus outbreaks like SARS and MERS, most people were actually very ill. And that was one of the things that enabled, CDC and the World Health Organization to contain these viruses before they actually became pandemics. The worry from the World Health Organization and the CDC is so many people appear to be able to get this without symptoms that that's one of the biggest problems in stopping its spread. Okay, how do you know you have the coronavirus? Well, quite frankly, that's the problem. In general, it acts exactly like the flu, but apparently it's a very mild flu for the vast majority of people. So, what should you do if you think you might have been exposed? Well, what the CDC is asking, if you even think you've been exposed, to self-quarantine. That means you stay at home and you don't go out shopping, you don't go to school, you don't go to friends and family's houses, and you just stay at home. The incubation of this virus seems to be anywhere from the latency of 2 days to a week to 10 days. And the CDC has recommended that most people, if they fear they've been exposed, just self-quarantine for that period of time. What are some of the things you can do to avoid getting the coronavirus? So, first of all, surgical masks, the one I wear in the operating room, are totally ineffective at filtering virus particles. Completely. They do nothing. Plus, what most people don't realize is that even the best surgical masks have gaps around the mouth, around the face, around the eyes, and it's not a perfect seal. And viruses can go through the mask, around the mask, and that's not going to do anything. There are medical grade masks that do filter virus particles, but here's the deal. They have to be perfectly fit, and secondly, they are so difficult to breathe through that people who are very susceptible to getting very ill from this virus with, for instance, chronic lung disease, many patients with COPD or emphysema can't even use these masks because it's so difficult to breathe through them. Furthermore, there is a suggestion that you can actually contact this virus through any mucous membrane. And guess what? Your eyes are a mucous membrane, and the mask doesn't cover your eyes. That's why you'll notice that all the healthcare workers who are tending for people with coronavirus also have goggles that seal the areas around their eyes. And that's why, because that's a mucous membrane that, so when you watch somebody going through an airport or down the street with a mask and no goggles, number one, that's not going to do you any good, and you'll still communicate if you have the virus right through that mask. So the question is, okay, well, if these masks don't work, why do surgeons wear them? That's a great question. And it turns out a study was done in England, actually when I was in England, to show that surgical masks actually have no benefit in preventing infections in surgical wounds. And the study was designed having surgeons wear masks for 3 months and not wear masks and looking at surgical wound infections. And interestingly enough, the masks actually promoted more surgical wound infections than not wearing masks, because what happens when we wear a mask is we talk during surgery, and the masks actually abrade our cheeks and chin, and it sloughs off bacteria that are on our skin into the wound. So why do we keep wearing them? Because quite frankly, tradition is tradition, and things are hard to change. Incidentally, recently a published study showed that making OR personnel wear complete jackets and coats and bouffant caps rather than traditional surgeon's caps and having short sleeves in the operating room had absolutely no effect on surgical infection rates. So many of the things that we think actually ought to make a difference in clinical trials don't make a difference or actually make things worse. What are some of the things you can do to avoid getting the coronavirus? So here's the deal. Your immune system is really good at handling any virus as long as you have a functioning, intact microbiome. And there are so many very good studies that show a diverse, healthy microbiome is the first line of defense for any viral or bacterial attack. Your microbiome is the first line of defense. Now, if you have a leaky gut, and I talked about this extensively, your immune system is so diverted to the attack at your leaky gut that you literally don't have enough of a robust immune system at the borders, at your mouth, at your nose, in your lungs, to fight out a normal pathogen that the immune system could attack. Now, here's the other really scary thing. The best thing you can do to make sure your immune system doesn't work properly is to eat sugar or things that turn into sugar, because sugar suppresses the immune system better than almost any other thing that you can do. So the last thing you want to do is have a candy bar or even a bowl of cereal or a piece of bread, which quite frankly is pure sugar. So the more you stay away from sweets, cookies, crackers, cereals, candy during this season, the better off your immune system is going to be. What would you say to someone traveling right now? Well, I recently interviewed Dr. Mark Hyman, my friend, on my podcast, and he and I agree. Certainly, it's time to cancel plans to go to China or South Korea or Milan or Northern Italy, where these outbreaks are intense. Should you cancel plans to go visit your friends or relatives in the United States? Absolutely not. For instance, I'm planning to be in Paris and the south of France next month. I have no plans to cancel my trip, even though the south of France is quite near to Italy. Interestingly enough, there are no known cases in North Africa, in Morocco, even though there are known cases next door in Libya. And there are a number of cases now in Nigeria. Now, will there be more cases? Absolutely. You know, the World Health Organization has now upgraded their threat level to pretty much the highest that it can go. Because this virus is going to spread, and it's going to spread because people are going to get the virus without really knowing they have it and go home and give it to someone who's far more likely to get sick from the virus. Are there things you can do on the airplane? Interesting study shows that people on the window seats are actually the least susceptible to contracting some airborne illness while on an airplane, which makes a lot of sense because the farther you are from traffic going back and forth down the aisle, and the air circulation is actually the poorest on the window seats, so you will get less of the ventilation effect. Now, don't make a mad dash for the window seats, please. But I frequently try to travel whenever I can control my seating assignment with a window seat for that reason, and that reason only. Is there anything you can do on airplanes and in airports to avoid contracting the virus? First of all, hand washing is still the #1 recommendation for the CDC. That and that alone will fix most of the problems. Okay, so I do not wipe down trays. I actually don't let the tray down. I use, if I want to watch a movie or something, I use my own iPad. I don't use the touch screen on, if there's one on the seat. Carry your own stuff. That's the easiest way. Plus, why in the world would you put the tray down? Because you're certainly not going to eat the airline food. You're going to bring your own food that you brought from home and you made. So I see absolutely no reason to put a tray down. Even if you have kids, you better be feeding them the food you made rather than exposing them to the crap on airlines. Do you need to carry hand sanitizers? I have absolutely never used these things. I like my skin microbiome. Your skin microbiome is the #1 defense system against other bacteria and other viruses. So no, I don't recommend using hand sanitizers. Simple soap and water is all you need, and that's all you need to do. How can you support your immune system so you're less susceptible to the virus? That's a great question. So #1, you've got to make sure you have adequate levels of vitamin D3. And the average person should take a bare minimum of 5,000 international units of vitamin D a day. A paper written from the University of California, San Diego a few years ago, after extensive research into humans, thinks that the average American should take 9,600 international units of vitamin D3 a day to have adequate levels of vitamin D. I personally have not seen vitamin D toxicity after 20 years of measuring this in thousands, tens of thousands of patients. Again, I recently talked with Mark Hyman in his practice. He has yet to see vitamin D toxicity. I personally don't think it exists, but even if it does, 10,000 international units a day is what the University of California, San Diego recommends. You probably have heard me talk before. If I feel I am coming down with a virus, I personally take 150,000 international units of vitamin D3 a day for 3 days in a row. That's almost 500,000 international units of vitamin D over a 3-day period. I've been doing that now for about 18 years. I'm not dead yet, and so far so good. Now the second thing you can do, and this actually harkens back to Linus Pauling's research. Linus Pauling is the famous vitamin C doctor. He won 2 Nobel Prizes in physics, but he believed, and there's very excellent evidence, that IV vitamin C is one of the most effective combatants against viral illnesses. And quite frankly, in some of my patients with severe pneumonia from the SARS virus, I actually gave them intravenous vitamin C continuously in the ICU. And one woman, quite frankly, who I remember very well, a very young lady, actually survived, and when she was on a ventilator, and we literally couldn't oxygenate her blood with traditional means, and I was able to get a waiver from our pharmacy to give her vitamin C IV, and that's actually what turned her around. Now, you're not going to get IV vitamin C before you go on a trip or take it on the airplane. So what I recommend is one of two things. Either take timed release vitamin C capsules, and they're readily available. I like 1,000 milligrams twice a day. But if you don't have that, go to any drugstore, any health food store, get the chewable vitamin C tablets. They come in 500 milligrams. And chew 500 milligrams of vitamin C at least 4 times a day. Here's the problem with vitamin C. It's water soluble, and we excrete the dose literally after 2 to 3 hours. So then it's gone. So you always have to replenish your vitamin C. And again, the easiest way to do this is just carry a bunch of vitamin C tablets with you and chew them every 4 hours, and you'll be just fine. Third, mushrooms are some of the best ways to activate your immune system, to activate killer cells, which are white blood cells that will go after viruses. Consider getting yourself some mushroom capsules, and that's another great way of adding another layer of defense. Lastly, sunlight is one of the best ways to generate vitamin D in your bloodstream, the active form. So whatever you do, get yourself a half an hour exposure to sunlight wherever you are. And that's one of the best tricks. Yeah, so if you think that you're getting infected with, a virus, whether it's the flu, whether it's the coronavirus, this is exactly what I would recommend to you. And again, it's exactly what I do when I feel like I'm coming down with something. If you want to, just say, wow, that sounds like a lot of vitamin D, which I used to think was, I used to take 50,000 a day for 3 days in a row. And interestingly enough, I had a few episodes of breakthrough. In other words, it didn't work. And so I talked with one of my colleagues in Texas, Dr. Osborne, who said, that's much too low a dose. No wonder. You should be taking 150,000 a day. I said, wow, that's a lot. And he said, oh, that's actually what you need to work. Vitamin D is actually one of the best antiviral hormones there is, and it's a hormone, it's not a vitamin. It's good for what ails you or what might get you. At Mrs. Bry Marie, here the genome of the virus shows it is man-altered with a snip of a SARS virus in it. Do you agree? The SARS virus is a coronavirus, and viruses constantly mutate. That's why, quite frankly, the flu shot is not very effective because it's made to the previous virus. So, sure, you can see on the internet, watch out, there's a piece of the SARS virus in the coronavirus. These are all coronaviruses, so they all will mutate. Is the coronavirus the latest of a long line of mutating viruses? And the answer is yes. So we don't have to speculate that some evil genius in China was experimenting with a death bomb and it got loose. This is a natural progression of what viruses do. They mutate. At Jen Winter 120, it seems that it's secondary infections like pneumonia that's making it fatal. After reading your book, I'm super wary of antibiotics, but if I contracted coronavirus and then pneumonia, should I take antibiotics? Well, the answer is the antibiotics you would get if you had pneumonia as a consequence of the flu or the coronavirus would be intravenous antibiotics, not oral antibiotics. And there's not as much evidence that intravenous antibiotics are going to have the same effect as on your microbiome as oral antibiotics. So antibiotics are life-saving when they are used appropriately. So don't even think twice about taking antibiotics when they are used appropriately for a bacterial infection. Also remember, antibiotics have absolutely no effect on viruses. And the vast majority of antibiotics given in this country are given for people who have a cold or the flu, and they have absolutely no effect on those viruses. I've also heard steroids are used to treat it. What's the verdict with those in terms of gut health? So yes, oftentimes with severe cases of pneumonia, we will give intravenous steroids. And that's actually to calm down the aggressive inflammation that the immune system does. And oftentimes it's the inflammation and the, if you will, pus that occurs from these infections that is the reason why we can't ventilate people's lungs. So it's not going to have a long-term effect on gut health. At A.Raya Sunshine, travel advisory for pregnant women, not at all, or what precautions? Same sort of thing. First of all, you obviously don't want to go to pockets of where this is currently very active, and I've already named those places. But that doesn't mean you shouldn't go visit, friends or family, and take the usual precautions. In my book, the Plant Paradox Family Cookbook, there's very good evidence that pregnant women should make sure their vitamin D levels are adequate for the fetal development as well. So lots of good reasons to take vitamin D. At Newsy, what about international conferences? Safe to attend? Anything we can do besides wash our hands and avoid 15-minute conversations with people? Again, it depends on where the conferences are being held. I'll give you an example. One of the most famous tennis tournaments in the world, the Indian Wells BNP Paribas Open, is scheduled to start in early March in Palm Springs, California. And as of yesterday, they are considering, they haven't yet, canceling the tennis tournament because players and people from around the world congregate in my lovely community for 2 weeks. And that's how serious the coronavirus is being taken. But again, if you're going to an area that has not seen this virus, you don't have to not cancel your plans. I was scheduled to talk in a conference in Hong Kong in the end of May, and that conference has been canceled for Hong Kong. Again, probably for really smart reasons. 15-minute conversations with people. Unless people are spitting actively in your face and you're that close to them, no, you can talk to people for longer than 15 minutes. At Milo Grobs, should we stock up on non-perishables in prep for an outbreak? If so, any suggestions of healthy foods to stock up on? That's actually a great question. And here's the deal. Frozen vegetables have actually all the nutrients of fresh vegetables. So you don't actually have to stock up on cans. Just stock up on frozen vegetables and make sure you get yourself a lot of olive oil ready to go. And I actually have a stock of Eden brand canned beans because many times after a busy day, I will just open up a can of Eden beans, throw in mushrooms and Tuscan kale or any other greens I've got laying around in my refrigerator and cook up a plate of beans, mushrooms, and green things. And you can live, quite frankly, forever on that dish. And all my critics who say avoid beans, you're not listening to me. Treat beans with respect. And once you've delectinized them, they are incredibly good for you and your gut microbiome. At Best Sop, do I have to worry about products coming from China? Well, quite frankly, if you would look at the port of Long Beach, at the port of Los Angeles, at the port of Seattle, you will find that they are empty because the ships are not coming from China right now. And it's already taken care of. The reason the stock market is crashing is because so many products come from China, and that entire product pipeline is now interrupted. That's why the stock market is crashing, not because the coronavirus is killing everybody. Remember, our regular plain old flu virus has killed far more people than the coronavirus, and probably will continue to do so. At Resilient for Life, do you think organic herb-based tinctures like Dr. Schultz's product can help fend off the virus? There's a lot of interesting suggestions that, for instance, oil of oregano, basil, ashwagandha are all useful. There's not a lot of hard, even experimental evidence that these are useful. Again, if for my money, vitamin D and time-release vitamin C or chewable vitamin C is so much better for you. At glyphosoma 2x6, would using a high dose of vitamin 3 and using heat, such as a sauna, be a way to prevent or kill off coronavirus? Well, I think I've already touched on vitamin D. Heat activates what are called heat shock proteins, which I've written about and talked about. So yeah, sauna is actually a great way to go. At Paul Buer, can you prevent getting the virus by following the plant paradox plan? Well, one of the things that so many people have told me through the years is that following the plant paradox program, they don't get sick anymore. And again, I think that comes back to the basic underlying principle that number one, your gut microbiome, a healthy gut microbiome, is your best defense against any pathogen that comes your way. And an intact gut wall without a leaky gut keeps your immune system not focused on all those nasty things that are coming through the wall of the gut and are then better able to defend you. Actually, just yesterday I saw a patient where we know he has an autoimmune disease, and we did these leaky gut tests, and he had absolutely no immunoglobulin A detectable in his bloodstream. And immunoglobulin A is the immunoglobulin that we use to tag pathogens in the lining of our gut and our mucous membranes and in our nose and in our lungs. And what that means is he's used it all up. He's been so inundated by a leaky gut. And so if you've used up all your immune system because of a leaky gut, you're a setup for any little pathogen that's going to come your way. Okay, so that's it. This is not a virus that we have to panic about because we have seen iterations of this virus before. And I can guarantee you we're going to see the next one in a few years. There is no vaccine for this virus. The vaccine will not be here, so you can't sit around in fear, oh my gosh, I have to have the vaccine. You have the ability to make your immune system vigorous that can fight off just about anything Mother Nature can throw at you. And nobody used to get these viruses before our immune system was profoundly compromised. So just take back, inhale, exhale. Obviously, don't head over to Wuhan, China right now, or Milan, Italy, even though I love you Northern Italians. I'll be there when all this passes, I guarantee it. But for now, just get your vitamin D levels up, take your vitamin C, get your gut microbiome happy by following the Plant Paradox program, and be calm and carry on.